about some problems which I've come across in the use of Baclofen, and which I anticipate will cause many medical practitioners and users of Baclofen for alcoholism a problem. I'm not a doctor, and I'm not here to recommend that you use Baclofen. Any use of it should be prescribed by a doctor under the advice of a specialist who understands the use of Baclofen for treatment of alcoholism. Now, the problems which I want to talk about, I will group under three categories, which are diagnosis, delivery and dosage, although delivery and dosage tie in together. So the first issue is that of diagnosis, and this raises a problem because most illnesses are diagnosed by some sort of test. For instance, with lesions or growths on the skin, a doctor would take a biopsy to determine whether it's cancerous. With viruses, a swab can be taken, blood samples can be taken for other illnesses. But alcohol is one of those illnesses which typically has and traditionally has not been treated by the medical profession or the scientific community as a physical illness. And in fact, the standard diagnosis tool for alcoholism is contained within what's called DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. And the key point there to bear in mind is that this is a manual of mental disorders. So alcoholism falls under what is called substance abuse as an illness, and it is now referred to under DSM-5 as alcohol use disorder. So rather than taking some sort of physical test, and one could think of tests that one could take, such as blood tests, breath tests, liver function tests, for instance, which would give some idea of the state of play in terms of someone's alcohol use, both at the time that the test is taken and the long-term effects, for instance, on the liver. One could also imagine the use of scanning techniques on the brain to determine the state of play of the brain's neurology, for instance, but that's never going to be used for this. And it'd be very difficult, one would think, to tell what effect alcohol had in, even by looking at one, even if one were to be taken, and you won't get one in any event. So what are we left with under the definition of alcohol use disorder in the DSM-5? Well, what it says is that the practitioners should consider issues of alcohol-related issues when the standard diagnostic criteria indicate the presence of an illness, and these consequences are reflected in the diagnostic criteria for alcohol use disorder. The alcohol use disorder is defined as resulting in one, the taking the substance in larger amounts or for longer than you meant to. Two, wanting to cut down or stop using the substance but not managing to. Three, spending a lot of time getting, using, or recovering from use of the substance. Four, craving and urges to use the substance. Five, not managing to do what you should at work, home, or school because of substance abuse. Six, continuing to use even when it causes problems in relationships. Seven, giving up important social, occupational, or recreational activities because of substance abuse. 8, using substances again and again, even when it puts you in danger. 9, continuing to use even when you know you have a physical or psychological problem that could have been caused or made worse by the substance. 10, needing more of the substance to get the effect you want. In other words, you would develop a tolerance to it. 11, development of withdrawal symptoms, which can be relieved by taking more of the substance. And what DSM-5 says is that anyone meeting any 2 of the 11 criteria during the same 12-month period would receive a diagnosis of AUD. And the severity of an AUD, mild, moderate, or severe, is based on the number of criteria met. So I'm hoping to see that the problem with that, as distinct from a diagnosis of a proper physical illness, is that it relates to, it uses the consequences of the drinking and the severity of the drinking. And effectively, most of those are just simply that one is drinking a lot and having the consequences that one normally associates with it right across the range of one's activities during one's day and in one's life. And so they don't actually, it doesn't actually give a physical diagnosis. Now, what's interesting about that, of course, is that Olivia Meissen, who is the pioneer of modern use of Baclofen for alcoholism, puts alcoholism as a neurological physical illness. And none of these give any indication of whether there is this physical illness, other than that the consequences are there. And these, of course, these diagnostic criteria, having been changed over the years slightly, predate a Meissen's theory, and they're still used. So they don't actually address whether there is the neurological anxiety that a Meissen refers to, and whether that's a physical illness. So what we start with is simply a diagnosis based on observation. And of course, when you see a doctor, he's going to take a history, and he's going to ask you all these questions, and he's only going to rely on you for the answers to this. And of course, whether you are, according to your doctor, suffering or not suffering from this disorder is going to depend on the answers you give. And those answers will be subjective. So this is very much a subjective diagnosis, and in fact, largely self-diagnosis of the illness, which, if you are looking at a neurological issue which needs to be treated with medication, isn't actually going to tell you whether you actually do suffer from this, if you take my point. There would be perhaps a presumption, it might be indicative that there's a problem, but it doesn't actually tell you whether you have this problem. And this is one of the problems that I foresee, that you are going to be treated or not treated on the basis of whether you answer these questions honestly and the degree to which you exaggerate them or downplay them, depending on the result you want to get from the doctor. So you start off with something which is very subjective, and leading on from that, you have the problem that all of these criteria revolve around a condition which worsens with time, and which, as it says in the manual, can be mild, moderate, or severe, whether you suffer from one or more of them. And as you can see from them, for instance, giving up important social, occupational, or recreational activities, using the substance again and again, causing problems in relationships, spending a lot of time using, or recovering from use of the substance. A lot of these criteria reflect an illness which is progressively more and more debilitating, so that the more one becomes alcoholic, the more one would expect one to be debilitated in the way set out in the criteria. So the more serious the illness you have, the less likely you're going to be able to cope with the self-administration of this medication, which leads on to the issue of delivery of the medication and its dosage. And if you look at the prescribing guidelines for Baclofen, and the way it's used, and recommended to be used by doctors, you'll see that because of the side effects of alcoholism, doctors have come up with this idea that you, some people say, titrate or increase the dosage gradually, so that, for instance, you take 5 milligrams on the first day, and on the second day you take 5 milligrams a day. If you felt some side effects from that, you take 5 milligrams until you no longer feel side effects, before moving up to, say, 10 milligrams a day. And you gradually move up so that the side effects are bearable. Now, when you start getting up to higher dosages, the recommendation is also that you take those doses regularly through the day, because the idea is to keep the chemical balance in your body level. So you don't want to take all the dosage in the morning and then it wears off. It has a half-life of 4 hours, so 4 hours later you have a crash, and you relapse. And unfortunately, when you relapse from or stop taking Baclofen, the urge to drink comes back, and so you can very easily slip back into reaching for alcohol. And so when you get into dosages where you're looking at having to take 20, 30 milligrams a day spread over equal dosages from the morning through the day, with doses in the middle of the day, and even possibly taking them in the middle of the night, the more severe a case of alcoholism, the more severe are your disabilities going to be in terms of keeping track of how much you're taking and in actually taking the medications. And you may suffer from some memory loss from alcoholism, disorientation, and just general lack of complete sort of control over your daily life. Certainly in the most severe cases, you find people who are really unable to get out of bed from one day to the next for long periods of time, and end up sleeping away the day and having very, very chaotic lives indeed. And so in the most serious cases, it would be very difficult for someone like that to self-administer these doses in any meaningful way, which made sure that they were keeping the level of Baclofen in their blood at a constant level. And that leads to the problem of ceasing taking it, relapse into alcohol use. And of course, if you are able to get a prescription from a doctor, he's not going to be there with you. And you'll be expected to take it on your own. So in effect, the less of an alcoholic you are, the less chaotic your life is, the more control you have over your day-to-day life, the easier it will be, and the more chaotic your lifestyle, the more difficult it's going to be to maintain a dosage schedule. And so, in fact, the higher the dosage you get, and Nysen talks about going up into the 200 milligrams a day, spread evenly, this sort of thing, the more you take, and the more regular you have to take it through the day, the more times you have to take it, the more difficult you're going to find to keep on a proper schedule. So it almost presupposes that you are in sufficient control of your faculties and your lifestyle, that you probably don't need Baclofen at all, because the alcohol isn't affecting you to that degree. And certainly in my experience, that those with severe alcoholism, very severe alcoholism, who need this drug the most, are completely incapable of administering these dosages to themselves. And because you're under a doctor, and you want the doctor to continue to prescribe, there will be a tendency to say, yes, doctor, I have taken my doses, even though you haven't. And that may lead to another problem of, should we call it patient-doctor fatigue, in that the medication, the treatment may not go in accordance with what the doctor is expecting. And you may find yourself in situations where the doctor's called out, or your spouse or friend is calling the doctor and saying, look, this isn't working. And you're giving the impression that it isn't working, all the while saying to the doctor, yes, I am taking the dosage. So which is counterproductive, of course, because at a certain point, the doctor's going to say, this isn't working. You haven't stopped drinking. You're still getting yourself into trouble. You're coming to my office in a state where you're not making appointments. It doesn't seem to be working. You're turning up to my office with the smell of alcohol in your breath, and you're telling me that you're up to 200 milligrams and it isn't working. So this doesn't work, does it? When in fact it's not the medication, it's the inability to maintain the right dosage because of the illness itself, which leads then to the question of how do you deliver this to someone suffering from severe alcoholism? And how do you even start it? First of all, you've got to get someone who is a severe alcoholic to say, right, I'm ready to go to a doctor. You've got to get the doctor to prescribe it, and that may involve the doctor getting expert evidence from a specialist in alcohol treatment who is familiar with the dosage regime, and because you won't find that many general practitioners are that boned up on this treatment, and you'll find very few who are prepared to put in the hours that it takes to over a period of time to deal with a patient who is suffering severely from alcoholism. And nor will you have someone would be able to get someone admitted to hospital for this type of treatment. So you're looking either at self-administration at home, or you're looking at inpatient treatment in a rehab clinic, which uses Baclofen, and they are now using it. I think you find that most doctors now know about this. Certainly most alcohol practitioners know about this, and almost all, I would say all, rehab clinics know about this treatment. Whether they're prepared to give it to you, whether they feel that there's some other medication that's more suitable for you is another issue. And whether they're able to administer this correctly is another issue. I don't know the answer to that. But certainly if you're at home, you're going to have difficulty, in my view, unless you have someone who is a member of your family or a friend who is prepared to give up a large portion of their time on a daily basis for a long period of time to deal with this delivery. And even in the best of all possible worlds, you're going to find that even with someone who is prepared to devote all of their time to you, that it's going to be very difficult for them to maintain the level of supervision necessary to ensure that you take these doses correctly. And of course, as a layperson, it's very unlikely that you're going to be able to afford to pay someone who is versed in this sort of treatment to come and live with you. or to turn up at your house every few hours, you're going to find it very, very difficult. They will find it very difficult as a layperson to oversee this kind of dosage. And of course, if they also miss doses and the patient reverts to alcohol use, you're into a very, very difficult situation because, for instance, if the patient gives up taking it during the day, spits the medication out, for instance, finds some alcohol that they've hidden somewhere and starts drinking again, you're going to find it very, very difficult to reinstate the treatment, and particularly a layperson. And that, of course, raises issues of, someone trying to force the medication on you, which they can't do. This has to be consensual. And it also raises the issue of, is the patient completely honest? And with a lot of alcoholics, there's a tendency to mislead about the actual level of alcohol consumption for obvious reasons. So those are the three issues. You're going to find, I think we're going to find that this is a treatment which is very difficult to roll out to the general public, which is going to be more easily used by people who are able to cope with the dosage regimen, and less easy to comply with for those who are severely affected by it, but need it the most. And in my view, this is the problem with baclofen treatment, effectively in a nutshell, because whereas you have medications like naltrexone or nalmefene or Vivitrol, whatever it's being marketed under these days, is concerned, the idea is to take the medication before you drink. It's a different type of medication. It's a prophylactic. It's supposed to deaden those receptors which give you a kick from drinking, so that you don't feel, that you want to drink so much. You're supposed to, over time, think, well, it's not giving me as much of a buzz, so I'm not that fussed by taking it. So it's a psychological thing, as opposed to obviously affects your neurology, but it's intended to work psychologically by making you not want to drink because it isn't giving you the kick that you want out of it. So you decide eventually, why am I bothering with this? Well, if you have a neurological addiction to it, an overwhelming anxiety-based neurological illness as a result of a physical deficiency in your brain, you are not going to stop because you want to. And that's what is so important about what Olivier Meissen says, that he came to realize that it was completely out of his control. And so what you have here is, with the DSM-5, is a diagnostic tool which really focuses on the results of alcohol consumption and alcoholism, and would lead you to think, well, the people who are going to be most in need of this are the people who are least able to manage the dosage and adhere to the prescribing guidelines, and that causes a real problem, because if you don't have these issues so seriously that you have this condition in its worst form, you may not have that neurological condition. So you may qualify, you may have a doctor who diagnoses you as an alcoholic, but you may not have that neurological anxiety at all. And so by using that as a guideline for someone to diagnose alcoholism as an alcohol use disorder, you may in fact be setting them up to failure. Because if you say, right, I think you can do this yourself, I've listened to your self-diagnosis and you meet a couple of the criteria, so I'm going to give you this medication, and I think you can comply with it without any help, and you send them off, first of all, it may be that if they can comply with it, then that they don't have a neurological condition. So you're giving them a medication which should not be indicated for whatever the causes of their drinking. And if you look at this, look at someone who has a more serious issue, you may be giving them something which simply put them in a situation that simply sets them up to fail, that they're simply unable to comply with the prescribing regime that's required to make this a success. So where do we go from here? I mean, where do we go from here when you have an illness which is so difficult to manage in its extreme cases, but is so deadly for those suffering from it? They really do need medical intervention. Well, I mean, that's what I think the next stage is in the development of regimes and treatments for alcoholism using Baclofen. Now, if you look at the prescribing guidelines which have been put out by doctors in Paris under the guidance of leadership of Dr. de Beaurepaire, you'll see that there are two prescribing guidelines. And the first one, in which I was involved as interpreting them into English, you'll see that they quite clearly stick to the regime that I've described, of starting with a low dose and then moving on up until you reach a point where you no longer feel craving for alcohol. But what they did in 2016 is that they changed that, and there's a very interesting addition to those prescribing guidelines, which suggests that you should take this medication before you drink, which is interesting, because what it suggests to me is that doctors involved in treating alcoholics are, generally speaking, treating people who are able to get to their surgeries under their own steam and are prepared to say, yes, I will take this medication myself. These are people who are probably in work, who are probably functioning fairly well, but who have decided that they have an alcohol problem and have recited a list of issues in their lives, which has given rise to the doctor agreeing to a diagnosis of alcohol use dependence. And it may be that these are people who are looking for an answer because perhaps their employment requires that they deal with this, or their matrimonial situation is in dire straits, but who really aren't suffering from the condition which Shemaisen describes, which is a physical, neurological anxiety disorder and needs to be treated by this drug. And so how do you separate out those people who are able to treat themselves from those who aren't? And it's those who aren't who are in the greatest need of treatment with this medication. And so that is how I see this going forward from here. And from my discussions with doctors or certainly the coordinator of the French group, not as many doctors are taking this up as they had hoped. And perhaps that's why they changed the recommendation of how to take the drug as one of taking it before you drink, because it's easier, and they are directing their efforts towards people who are able generally to function from day to day, and are not such severe cases. And perhaps they're finding it frustrating with people who are more severely affected and are writing them off. I don't know the answer to that. But it may be that they're giving medication to people who are past the point where they can self-administer this drug. And those patients are coming back and saying, or not coming back, but if they're coming back saying, it didn't work, rather than saying, I simply wasn't able to administer this myself. They're not brave enough to say, look, doctor, I'm just too far gone. I can't do this. And of course, alcohol is one of those things which make you say things and do things that you wouldn't necessarily do if you were thinking straight and weren't drinking alcohol. So it's a vicious circle, alcoholism. But I think it needs a lot more attention. And certainly, my approach would be to say that you do need someone, if you are an alcoholic, in your life who's prepared to give up a huge amount of their time. And you have to agree with them that they are going to be able to, put some friendly pressure on you to take this drug without necessarily taking physical action against you and forcing you to take it. But that they should also, you should also have a doctor at the end of the line who's prepared to talk to the patient and coach them through the use of it, encourage them. And I think without that, you're going to have difficulty if you have a severe case of alcoholism, or in yourself or in the family. You have a very serious difficulty with keeping up with the regime that this requires and the dosage that this requires. So that's why I say that there's three issues which need to be addressed in moving forward with Baclofen treatment. The diagnosis, if there were some other way of finding out whether the person actually had the illness that Amycin is speaking of, that would be a wonderful thing. And having found that out, those particular patients have to be targeted. And they have to be targeted in such a way that they take an effective dose of it. And that means taking it regularly so that they don't relapse. And that requires, in many, many cases, and I would say the majority of cases of severe alcoholism, more than self-administration. It requires the help of family, friends, and a doctor who's prepared to roll up his sleeves and answer phone calls, and if necessary, come to the house and see the patient. So those are my thoughts on it. Leave any comments if you want. I'm going to do another video shortly, I hope, on the legal aspects of Baclofen in court cases, because I feel it's very important. A lot of people with alcohol problems get into quite serious legal difficulties, and the law has a very peculiar way of dealing with alcohol-related offending. And I've written a paper on this, which addresses how you can use a defense based on alcoholism being a real neurological illness and one which is treatable, to help you in courts. So that's all for now. I hope you enjoyed that, and thanks for watching.